There's a chance that COVID-19 will make existing inequities in healthcare worse. We're talking about lack of health insurance or people who just can't take the proper precautions. Here to shed some light on the issue from Hartford HealthCare is Sarah Lewis. She's the Vice President of Health Equity for our viewers. Nice to have you here. Thank you. Sarah, if you would explain to us how your department has really stepped up in this crisis.
Sure. Thank you so much for having me this afternoon. So, as we know, there are existing inequities and existing health disparities among populations across the state of Connecticut, and unfortunately, this crisis has the potential to exacerbate some of those. So, for instance, people who are already food insecure or economically insecure are at a risk of going without food for an even longer period of time, or losing their jobs because their businesses have been shut down. And as a result, we're looking at all of the solutions that we could potentially offer because our healthcare system is more than one that is made up of hospitals and physicians' offices. We're also part of a community, and we think about the social needs of our patients and their families, and so we're figuring out how we can step up and help in those areas that I mentioned.
Sure. And Sarah, yesterday, a New Haven man, a homeless man, he tested positive. What can happen to that population who really can't do the social distancing?
Right. So, we're telling everyone stay home, stay safe, but for people who are unhoused or experiencing homelessness, it's very difficult for them to follow those instructions, even though they want to. I think it's important to realize that our populations experiencing homelessness, many of them already have a number of underlying health conditions that make them more vulnerable to a COVID infection. So we're working closely with the City of Hartford and the state of Connecticut and our other municipalities across the state to understand how we can help them in times when they need to isolate people who have a suspected case of COVID-19, help them in their quarantine efforts, and of course get them the medical care that they need at the time that they need it, and provide access to testing and triage as those things become needed.
Sarah, let's talk a little bit about hourly workers. They're going to face all new hardships when this virus continues. This could turn into big mental health problems, trying to make ends meet. What sort of advice do you have for them?
Well, I first and foremost just want to say thank you for all of your diligent work keeping our economy afloat up to this point. I know that we have some really hardworking people out there who are looking at their bank accounts and suffering and wondering what's going to come next. And I want to suggest that be compassionate with yourself and others. And also, if you need some help, please come to our website, connectionsthatmatter.org, which is a website that we stood up last year to help people who are in need find resources in their community. You go online, again, it's connectionsthatmatter.org, all one word. You can put in your zip code and find resources in your community for economic assistance, for food assistance, housing assistance. A wide variety of organizations have made their services available through that website. And just know that we're here for you, and we're on the other side when we get through it.
Sure. And so are you hearing about any sort of discrimination in the Asian population?
Yes, thank you for bringing that up. Unfortunately, in times of public health crisis, there's a history in this country and others where we see an elevation of bigotry and racism, and unfortunately this has been no exception, and it's absolutely unacceptable, and unfortunately it's happening for people who are within different Asian populations across our state, or even are perceived to be of an Asian descent or an Asian background. It's important that we look out for one another. We don't blame anyone for this. This is not the fault of any person or group, and we are all in this together, and Hartford HealthCare stands beside all of our community members with compassion. We stand against discrimination, we stand against bias, and that is how we provide care. We do it in an unbiased fashion to make sure that everybody gets the best care that they need.
Sure. Sarah, thank you so much for your time. You said it, we're all in this together. We appreciate you being here today.
My pleasure. Thank you. Take care.